Attachments on the radius. The biceps brachii is inserted into the rough posterior part of the radial tuberosity. The anterior part of the tuberosity is covered by a bursa. Supinator is inserted into the upper part of the lateral surface. Pronator teres is inserted into the middle of the lateral surface. Brachioradialis is inserted into the lowest part of the lateral surface just above the styloid process. The radial head of the flexor digitorum superficialis takes origin from the anterior oblique line and the upper part of the anterior border. The flexor pollicis longus takes origin from the upper two-thirds of the anterior surface, and the pronator quadratus is inserted into the lower part of the anterior surface and into the triangular area of the medial side of the lower end. Radial artery is palpated for the radial pulse as it lies on the pronator quadratus medial to the sharp anterior border of the radius, lateral to the tendon of flexor carpi radialis. Abductor pollicis longus and the extensor pollicis brevis arise from the posterior surface. The quadrate ligament is attached to the medial part of the neck. The oblique cord is attached on the medial side just below the radial tuberosity. The articular capsule of the wrist joint is attached to the anterior and posterior margin of the inferior articular surface. The articular disc of the inferior radioulnar joint attached to the lower border of the ulnar notch. The extensor retinaculum is attached to the lower part of the sharp anterior border. The interosseous membrane is attached to the lower three-fourths of the interosseous border. The first groove between the sharp crest lower part of the anterior border and the styloid process gives passage to abductor pollicis longus and extensor pollicis brevis. Surfaces of the radius. Anterior surface lies between the anterior and the interosseous border. A nutrient foramen opens in the upper part and it is directed upwards. The nutrient artery is a branch of the anterior interosseous artery, that is, branch of ulnar artery. The posterior surface lies between the posterior and the interosseous border. The lateral surface lies between the anterior and the posterior borders. It shows a roughened area in its middle part. Lower end is the widest part of the bone. It has 5 surfaces. Anterior surface is in form of a thick prominent ridge. The radial artery is palpated against the surface. The posterior surface presents 4 grooves for the extensor tendons. The dorsotubercle of the Lister lies lateral to an oblique groove. The medial surface is occupied by the ulnar notch for the head of the ulna. The lateral surface is prolonged downwards to form the styloid process. The inferior surface bears a triangular area for the scaphoid bone and a medial quadrangular area for the lunate bone. The surface takes part in forming the wrist joint. The first groove between sharp crest-like lowest part of the anterior border and the styloid process gives passage to abductor pollicis longus and extensor pollicis brevis. The second groove between the styloid process and dorsal tubercle gives way to extensor carpi radialis longus and extensor carpi radialis brevis tendon. The third oblique groove medial to the dorsal tubercle gives passage to extensor pollicis longus tendon. The fourth groove on the medial aspect gives passage to tendons of the extensor digitorum, extensor indicis, posterior interosseous nerve, and anterior interosseous artery. In addition, at the junction of the lower end of the radius and ulna passes the tendon of the extensor digiti minimi. Lastly, in the relation to the ulna, between its head and the styloid process traverses the tendon of the extensor carpi ulnaris. These are 6 compartments under extensor retinaculum of the wrist. 4 are in relation of the radius, 5th at the junction of the radius and ulna, and 6th on the ulna itself, its head and styloid process. Radius is the lateral bone of the forearm and is homologous with the tibia of the lower limb. It has an upper end, lower end, and shaft. Side determination. Upper end is having disc-shaped head, while lower end is expanded with a styloid process. At the lower end, the anterior surface is in the form of thick prominent ridge, while the posterior surface presents 4 grooves for the extensor tendons. The sharpest border of the shaft is the medial border, close to the neck. It represents the radial tuberosity. Lower end presents a tubercle on the posterior surface called as dorsal tubercle of Lister. Upper end. The head is disc shaped and is covered with the hyaline cartilage. It has a superior concave surface which articulates with the capitulum of the humerus at the elbow joint. The circumference of the head is also articular. It fits into the shock socket formed by the radial notch of the ulna and the annular ligament, thus forming the superior radioulnar joint. And the neck is enclosed by the narrow lower margin of the annular ligament. The head and neck are free from capsular attachment and can rotate freely within the socket. The tuberosity lies just below the medial part of the neck, and it has a rough posterior part and a smooth anterior part. Shaft. It has 3 borders and 3 surfaces. Borders. The anterior border extends from the anterior margin of the radial tuberosity down close to the styloid process. It is oblique in the upper half of the shaft and vertical in the lower half. The lowest part is sharp and crest-like. The oblique part is called the anterior oblique line. The lower vertical part is crest-like. The posterior border is mirror image of the anterior border but is clearly defined only in its middle one-third. The upper oblique part is known as posterior oblique line. Medial or introitious border is the sharpest of the 3 borders. It extends from the radial tuberosity above to the posterior margin of the ulnar notch below. The introitious membrane is attached to its lower 3/4. In its lower part, it forms the posterior margin of an elongated triangular area. The ossification of radius. The shaft ossifies from the primary center, which appears during the 8th week of the development, 8th week intrauterine life. The lower end ossifies from a secondary center, which appears during the 1st year and fuses at the 20 years. It is growing end of the bone. The upper end head ossifies from the secondary center, which appears during the 4th year and fuses at the 18 years. The radius commonly gets fractured about the 2 cm above its lower end. Okay, this is Colles fracture. This fracture is caused by a fall on outstretched hand. The distal fragment is displaced. Colles fracture with dinner fork deformity. Okay. The distal fragment is displaced upward and backward, and the radial styloid process comes to lie proximal to the ulnar styloid process. It normally lies distal to the ulnar styloid process. If the distal fragment gets displaced anteriorly, it is called Smith's fracture. Okay? A sudden powerful jerk on the hand of a child may dislodge the hand of the radius from grip of the annular ligament. This is known as subluxation of the head of the radius, pulled elbow. The head can normally be felt in a hollow hand behind the lateral epicondyle of the humerus.